Good morning all of you all. I am Megha Kavar Rajawat, lecturer at Regional College of Pharmacy. Today we are going to study subject Social Pharmacy, which is included in D.Pharm Part-1 syllabus, and the topic is Preventive Healthcare. As we already studied about the demography, first of all let me give a brief introduction about the demography. What does it mean? Demography means study of human population in the particular area. The area and the region can be a locality, can be a town, can be a city, can be a country, can be a continent. Okay. Second of all, from where does we get the data of demography? We get the data from the registration systems and the national health missions that can be run by our government of India. Third one is the census study. Okay. Then the third is what are the function of demography? The demography function can be like the distribution of population in particular area, distribution population in particular area, the composition of population, and third one is the it will give about the growth of population. Okay, what are the factors that can affect our demography? The factors can be fertility, marriage, inter-country marriage, whatever the reason that we are living in that marriage, for mortality and morbidity, social discipline, etc. are the some factors that can lead to our demography increasing, decreasing. Today we are going to study about the demography cycle. So in it we will going to mention about two terms in 5 stages. So 5 stages will be included in demographic cycles and 2 terms. The terms are birth rate and death rate. Okay, birth rate and death rate, these are the 2 terms. We are going to compare all the data from these 2 terms and there will be 5 stages. So first stage, can be known as high stationary stage. First of all, what does we mean by the word stationary? Stationary give us a data about immobile components. What are the immobile? That cannot be moved from one space to another space. Okay. So in terms of population, we can mention stationary stage as that there will be no increment and decrement in our population. Okay. So the first stage can be explained is the characteristic feature of this stage, that is high stationary first of all, and second the rate and the birth rate and the death rate, both will going to neutralize each other. Okay, and thus there is no increase in the population. इंडिया ही स्टेट जो आपका इंडिया है वो इस स्टेज में 1920 से है. इसके अंदर दोनों स्टेज बर्थ रेट और डेथ रेट दोनों की दोनों हाई होती है. ठीक है, दोनों की दोनों बढ़ रही होती है आपकी एक स्पीड से. अगर किसी जगह पर 100 चाइल्ड बॉर्न हो रहे हैं, 100 बच्चों का जन्म हो रहा है, तो वहाँ पे 100 डेथ भी हो रही है. तो इस तरीके से क्या होगा, उस एरिया की पॉपुलेशन न्यूट्रलाइज हो जाती है. ओके, सो what would you do? So जितने जहाँ पर जितने पॉपुलेशन होंगी आफ्टर दिस स्टेज भी उतनी ही पॉपुलेशन आपके वहाँ पे एस्टेब्लिश्ड होगी. सेकेंड स्टेज कैन बी टर्म्ड एज अर्ली एक्सपेंडिंग. What does this early expanding stage mean? This means the death rate starts decline without any changes in the birth rate. Hence, population start increasing. Okay, many countries like South Africa, Asia, Africa, and all are in this stage now. Okay, in this stage, birth rate has increased in some of these countries, possibly as a result because of the better medical facilities. Okay, इसके अंदर क्या होता है? The birth rate will still increasing and the death rate start to decreasing. This will result in increasing population. Okay, ये क्यों होता है? By the way, why the death rates are declining and the birth rates are increasing? There are some factors that can include in this, like for example, good better medical facilities. It will provide, like for example, if any person can be treated easily and the medical facilities can be provided to them, then the person can be prevented from the death and hence result in decreasing in the death rates. If the death rates will decrease, then likely easily the birth rate will going to increase, and if the birth rate will going to increase rapidly in comparison to the death rates decreasing rate, then the population size will start to grow. Okay, that's why it is known as early expanding. Early means, what does early means? Early means पहले वाले स्टेज, प्री स्टेज, जो स्टार्टिंग स्टेज होते हैं हम उसको बोलते हैं अर्ली. फॉर एग्जाम्पल वी मेंशन द टर्म अर्ली इन द मॉर्निंग. अर्ली इन द मॉर्निंग, द टाइम ड्यूरेशन लाइक 4 to 5 p.m. that can be termed as early in the morning. Okay, on expanding. Expanding is opposite word of stationary. Expanding means increasing. Why does the population will increase? Because the birth rate are start to increasing. It will stay in the starting stage for increasing, and second one, the death will start to decrease. So if the population is start growing, then the area can be termed as like it will have a good facilities, everything will provided at a betterment rate. That's why the population will start to increase. Okay, third stage can be known as late expanding. Let me write it. The third stage can be termed as late expanding stage. So the death rate continue to decline. The death rate continue to decline. Like in the second stage. Second stage also death rates will decline, and further in the birth rate tend to decline also. Okay, and the birth rate will also start to decline. Death rate will decline and birth rate will also start to decline. The population continue to increase because birth exceeds death. Many countries are in this phase, for example China. What does in third stage will happen? The population will start to grow. Population will increasing. Why? The reason is that for example, I will give you a rough figure. If in a population 30 people are dying, then 50 people having a new birth. Okay, so this was the late third phase.